Hello and welcome to the channel. This second part of the video, we're going to be talking about, varicocele and specifically the lifestyle changes. What can you do to implement a positive change in your condition, and what should you avoid? If you are a faithful subscriber to the channel, you should know by now that we have addressed in the first part the modification and some elements that you can incorporate in your fight against varicocele. So very important to understand, these are not quick fixes. These involve profound changes in your life and what you do in terms of nutrition, how you lead your life, where are you right now. It has a deep impact both on your life as a person, spiritually, physically, physiologically, nutritionally, and overall it will lead to hopefully a positive change in your health as a whole, and not just varicocele, because the human body function as a whole, and there's a deep connection between the spiritual and physical, and ultimately that will lead to you regaining all your health. So today we're just going to be focusing on the lifestyle change. The disclaimer, these are not meant to replace or be in contradiction of your healthcare professional. This is just for education. That being said, we're going to start by talking about what can you do in terms of your lifestyle. So first of all, we're going to be taking a look at what should you avoid and what can be stopped. So what can you stop? So the first thing, let's look at the toxics. The classic toxics. I'm not gonna be telling you anything new. I'm sure all of you guys know it. The cigarettes, the alcohol, and the caffeine. So I'm aware that what I'm going to be telling you may not be easy to implement, may not be something that you want to do, but this is a condition, and these things take time. These are not quick fixes. As I said, this is you in your way of health recovery, which may take weeks or even months. So let's take a look at the first culprit. So the first one is smoking and cigarettes. Over and over again, the studies have shown that cigarette smoking reduces sperm count, density, motility, leads to higher abnormality in sperm shape and function. It also relates to a higher rate of hormonal issues and erectile dysfunction. So relative to varicocele, cigarette smoking may increase varicocele pain, is known to have a large negative impact on fertility, leads to hormone dysfunctions and testicular shrinkage. So cigarette increase blood toxicity and may make your blood stickier. So that means less able to flow smoothly. And since varicocele impedes testicular blood circulation, if your blood is thicker, imagine now not only it's kind of stagnate, but it will move less easily. So this goes against the optimized blood circulation and quality. So you need to make your blood circulation better, not to make it worse. So the good news is studies have found improvement of all fertility and hormone parameters if you stop cigarettes. So this is just on varicocele. Of course, basically you are consuming your life away with every cigarette you take. So it's up to you. Again, choices between your hands, whether you want to do it or not. Next culprit, alcohol. You all know that alcohol is not really good for you. So alcohol in terms of varicocele and fertility is the leading cause of erectile dysfunction. It lowers your testosterone levels, it decreases your libido, it negatively affects many of the same parameters as smoking. So related to varicocele, alcohol will overload the liver, and the liver is the major organ for filtration and detoxification of the body. So the alcohol will have a negative impact on the liver, and this will ultimately make again your blood more viscous. So imagine now, if you smoke and drink at the same time, it's a negatively compounding effect. So this will also increase the cardiac output, meaning it makes and cause the heart to pump more blood. So pumping more and thicker blood will increase the amount of blood that will pool in your varicocele. Again, it's up to you. All you have to say is make that conscious decision to stop the harmful, nefarious effect of those substances on your health and on your body. Next culprit is not really one of the suspects. It's actually something that we all enjoy drinking, but unfortunately, if you have varicocele coffee or caffeine, may be worsening your symptoms, because caffeine causes a mild anxious states that last for hours, so until the caffeine will filter out of your system. The half-life of caffeine, meaning how much time it takes for your body to clear half of the percentage or the amount of coffee in your body. So the half-life of caffeine in your body is 6 hours. This means if you drink a cup of coffee with 140 milligram of caffeine at 10 a.m., by 4 p.m. your body still has half of it, which is 70 milligram of caffeine. And by 10 p.m. you're going to decrease it by half, which is 35 milligram of caffeine in your system. That means that by the time you go to bed at 10 p.m. you still have the equivalent of a quarter of a cup of coffee in your body. Okay, so imagine if you drink 2 cups, so that's the double. That means you will have a mildly anxious state that will affect negatively your quality of sleep. You're not going to go into that deep sleep that is necessary to the body to repair itself during. You're not going to have the quality, you're not going to have the depth of sleep, you're not going to have the duration of sleep. So caffeine is a drug that acts directly on the brain by stimulating the sympathetic pathway, which is the flight or fight response. The sympathetic pathway is bad for digestion, sleep, and healing. Now consider that caffeine causes thinning of the stomach mucus lining, irritable bowel syndrome, insomnia, and also may be related to lymphatic swelling. So if you have varicocele, and if you drink and you smoke and you drink coffee, I think it's time to reconsider your option. These are not easy fix. If you want the easy fix, feel free to go see the surgeon who will probably dismantle your spermatic cord. But if you want to restore your health, there are things that you need to do, and they are between your hands. So it's up to you to make the change for improving your health. Next topic, another question that I get a lot about people and young men especially that are anxious about masturbation and porn. And I think at this time of our era, I think they go together. So what can I tell you about it? It's easy, guys. I mean, stop watching porn. Stop watching pornography. This is an addictive, degenerative activity that will affect you at so many levels, physically, spiritually, etc. It is an addiction, and if you don't believe me, just try to stop watching porn and see. So that's the first thing. What can you do? Replace it with something healthier. If you feel the need to watch porn, just go take a walk in the park, drink, smell oxygen, smell nature, get in touch with nature, with the trees, with the flower. Exercise. Do exercise. Just do body weight exercise. That will put you in touch with your true self, with the creation, and ultimately with God. So that's the first thing. So if you do that, naturally you won't feel that need of masturbation. Masturbation is not really especially excessive masturbation. If you have varicocele, that's not advised. Why? I'm going to explain to you why. Okay, so there are research that have shown that when you have masturbation, excessive masturbation, your body will make a gas that is involved in the erectile function called nitrous oxide, NO. So this nitrous oxide gas is released into the veins, into the vessels. The function of which in erection, it kind of makes those blood vessels swell and dilate. However, if you constantly stimulate it, you will have a lot of this gas accumulating, which increase the vein diameter. You don't need to increase your vein diameters if you have varicocele. So that will that is associated with higher grade of varicocele and with, varicocele progression. Excess masturbation may lead to excess NO production, nitrous oxide, in surrounding tissue. Even after masturbating once, the varicose vein typically swell, the testicle heat up, the cremaster muscle relaxes. Pooling of blood in this case is not the cause of faulty valves, but excessive NO production, elevated temperature, and a low-hanging scrotum, all in combination with increased blood flow to the testicle. If you have to masturbate, then how can we do it? First, if you have to, don't do it excessively. Do lay down while masturbating. Lay down 10-20 minutes after masturbation. Sleep at night. Allow adequate post masturbation cooling, and have some days and period without. Try to abstain. Don't do it every day. Avoid physically rubbing or tugging your testicular vein. Sex is okay. Ideally perform a cooling treatment. If you're not familiar with the cooling treatment, please look at the part 1, the video that I did prior to that. What should you avoid? What is unhealthy masturbation? What not to do? Don't masturbate if you're sitting or sit after masturbation. For example, you're watching porn on your laptop or your computer and you masturbate and you stay sitting. Don't squeeze your penis aggressively. Don't masturbate before an exercise or strenuous activity or going out or traveling. Don't do it every day. Try to have days without. Don't do penile enlargement or take Viagra. So I hope this answers some of your questions. For those of you who were anxiously asking about this question, didn't find an answer. Don't do anything aggressive if you have to do it. Don't tug in your skin. Don't do anything aggressive or excessive. Don't irritate the skin of your glands, etc., etc. Okay, what's next? So this is the things that we should avoid. Let's take a look at the one of the culprits that may be related to varicocele is bowels. Bowel, very, very important in terms of health, especially the topic of constipation, which affects a lot of people now with modern nutrition, especially in Western countries. They have what we call chronic constipation. Chronic constipation is largely related to diet, the American diet, the Western diet, that will cause the bowel not to be able to push the food that you ingested, and especially if your diet is lacking vegetables and fibers and good fruits and natural nutrition, leading to formation of what we call diverticulum. These diverticulum do not exist in so-called developing countries because they have access to another type of more natural diet. So how does constipation affect you if you have varicocele? So if you have a constipation and you have to push hard to have a bowel movement, this increases the intra-abdominal venous pressure. Moreover, constipation typically comes with irregular bowel movement. This literally means that there is a buildup of feces in the intestine, which may exacerbate the nutcracker effect. In the long term, these risk factors contribute to both varicocele development and severity. So for optimal bowel movement, you have to manage your stress, your diet, your hydration, your activity, and maybe consider a few supplements. Stress. So stress can cause many negative body symptoms, including irregular bowel movement, constipation, inflammatory bowel syndrome, irritable bowel syndrome. It is a major factor you have to get under control. I know it's not easy. Life can be stressful. Everybody has his own life condition. Find ways to relieve the stress and the pressure. Do things that you enjoy. Get in touch with nature. Get in touch with God. And it's time to look at your spiritual component, because the link is proven is direct between the stress, your mental, and your health. The next is diet. How can we improve the constipation? So you really have to look at your stool in the toilet. If the stools are too hard, maybe you need to get more indigestible fibers from vegetables. If it's not smooth enough, you might need more volume from legumes, for example, beans, lentils, chickpeas, etc. If it falls apart too easily, maybe you need more sticky food like oats and oily food in your diet and less acidic and hard to digest food. If your food does not digest well, maybe you should have more yogurt or other fermented food and calories. So overall, look at these pictures. Do you think your food is missing? What do you eat? Look at your daily intake. Maybe take a logbook of what you eat during a week and see. You'll be surprised what you're missing. Do you really eat everything of what nature has made available for you? Anytime you're not missing or you're not eating, you are missing on something, some key nutrient that may help your health in your body and allow your body to function properly. So again, these are things between your hands. Next thing to improve the health of your guts is the hydration. Dehydration is a major cause of dry, hard stool. As food passes through your intestine, the moisture from it soaked up. This is even more pronounced when you're dehydrated. And since your body wants to retain as much water as possible. So in general, if you are dehydrated, not enough water, your stool gonna be harder and more difficult for your body to push, increasing that venous pressure, which may affect your varicocele. So again, hydration is key. The next step that will help you in decrease the bloated digestive system. So the digestive system is not only important for you, but for your varicocele, but for your overall health. So bloating is a major common digestive disease. The main cause of bloating is stress. Other major contributors of bloating is lack of exercise, poor diet, and eating on the go. Activity and exercise are important bowel health that we will discuss more in detail. So a diet low in probiotics and high in processed food and sugar tend to cause bloating. Bloating means you have too much gas, basically. Eating too quickly, then exercising or running the day task can irritate the digestive system and leading to bloating. So consider probiotics. Probiotics, did you know that the human body contains 10 times more bacterial cells than human cells? So from that, it's not hard to understand why upsetting the bacterial balance can cause many disorders. So our focus in digestion and probiotics are vitally important to that. You need to have some fermented food as a regular part of your diet. And I'm not talking about artificially sweetened yogurt. What I mean is fermented food like miso, natto, kimchi, pickled food, sauerkraut, chutneys, low-fat plain white yogurt. So these are just to help your bacteria in your gut. One thing that is not really well known is what we call the lymphatic system. The lymphatic system is an intricate network of a third type of vessel called lymphatic vessels. And they are connected to lymph nodes. The lymphatic system is a very, very intricate system. It branches reach almost the entire body. Major function are cleaning the waste products and fighting bacteria, viruses. It also has a role in the lipid metabolism. So the swelling of the lymph node indicates either you have toxicity, foreign invaders, or even cancer. So the lymphatic system is not pumped throughout the body by a pump like the heart, but the circulation relies on the flexion relaxation of the surrounding muscular tissue. Therefore, it is important to breathe deeply through your stomach to have a physically active lifestyle that helps you drain this lymphatic. So because lymphatic is connected to the venous system, it may also contribute to the varicocele. Specifically, if you have large growing lymph nodes or very large lymph nodes in the retroperitoneal space due to inadequate lymph drainage, these swelling of these lymph nodes may press on the blood vessels. But I think this is rare. Most importantly is the overall general health of the lymphatic system and lymphatic drainage, which is connected, as we say, to lifestyle, moving, etc., will allow you to have a healthy lifestyle and better healthy gut. Another cause that you can work on if you find yourself having a chronic cough. Cough increases intra-abdominal pressure and therefore irritates your varicocele and worsens your symptom. Since the causes of chronic cough are vast, I recommend consulting a qualified physician to treat your cough. Some cough you can control. For example, if you live in a city that has particular dry air that irritates your airway, you can purchase a humidifier, or you can even consider moving altogether from that city. Next, we're going to be talking about toilets and squatting on the toilets. Modern day toilets are not really natural for bowel movement because once you sit on it, they force a posture that pinches the natural flow of stool. So that means they will have excess pressure. So imagine on top of that, if you're constipated and you're sitting on a toilet, that's not ideal. Your venous pressure, intra-abdominal venous pressure will increase, and it will affect your varicocele. So correcting this is equivalent for controlling one of the stress factors that can contribute to varicocele development. How can you do that? You need to squat on the toilet. Squatting on the toilet is very healthy. This is how people in the past used to do. It is easier to have a bowel movement like that. I agree it's not comfortable, and people in Western and modern civilization are not used to it, but prior generation was totally natural to squat. So squatting is healthy, and you'll notice a difference in ease in your bowel movement. So I cannot emphasize how big of a difference a few lifestyle change can make. Healthy weight. Some studies have suggested that being obese may have less impact on varicocele. However, that's not what I see in the practice. We see people who are overweight, have a lot of health issues, a lot of dietary issues, suffering from varicocele that are not only severe but bilateral. And not only that, the main cause of them consulting is fertility. So when compared to those with normal weight, people who are obese are 42% more likely to have low sperm count. They have on average 24% lower sperm count and are 81% more likely to be sterile. So being obese also comes with many other problems that negatively affect overall health. So two advice always given for weight management. First, you must eat healthy, and second, you must exercise. It's really that simple. Exercise, eat healthy, avoid junk food, eat good food. Eat healthy, cut out the junk food, the fast food, the sugar food, the drinks, and the overly processed food. Make your diet balanced and whole. Research what food is good for you and what food is bad for you. Again, everybody is different. Every body, I'm talking about the bodies, they are different. What works for your friend, neighbor may not be adequate for you. Some people needs more meat, some people are fine just vegetarian. So research what kind of works for you. You will be surprised at how quickly your weight will change once you make dietary changes. Exercise more frequently. Again, this is easier said than done. It might be difficult for those who never exercise, so I reach out to groups. Do something that you enjoy, that have pleasure. It does not have to be a core. You need to have pleasure. Go and finding a group of people. I advise you to do group activity, whether it's collective sports, maybe martial arts, maybe something that you'll enjoy. Being a group, change your social environment, make new friends, and the group also will encourage you. You can definitely exercise solo, but this is more for people who have experience and are highly motivated. So consistency is key. First 2-3 months you're not going to see changes, and all of a sudden the third month you look back and you see tremendous changes. It is very helpful to join a regular scheduled group activity, and later you can gradually begin to research what exercise are most effective. Take it easy, but just be consistent. Follow these simple advice, eat health and exercise constantly, and you will attain a healthy weight with relative ease. So we come to the end of this second part. Hope it was helpful. As you see, I have not given you anything surprising, but if we put all these together and you add them to the first advices regarding varicocele change and control, this will positively compound into a health and beneficial effect. Remember, these takes time before you can see the change. We still have things to say about varicocele management, especially in the non-operative way, what food to eat, what supplement to take, etc. that we're going to be talking about in the next episodes. So please don't forget to subscribe, hit that bell button if you haven't done it to stay notified by new uploads. Leave me a comment if you have a question, if you have a comment, if you have a specific question that you want me to treat, let me know. And thank you for your time and attention.